Welcome to Courtney on Health, brought to you on malcolmpresents.com, a streaming service which produces its own half-hour original broadcasting. And it's on demand and archived for your pleasure. Anyway, welcome, Courtney. Welcome,
Hello.
Max.
Yep. Hi,
Max,
hi, both of
take it away.
I'm taking it away. So, and then hi, Courtney, and hi, Malcolm back. Welcome to Courtney on Health, a Zoomcast podcast streaming series. I'm adding streaming, which focuses on one's overall well-being with tips on nutrition and exercise, given by Courtney Gravenese, registered dietitian with a Master of Science degree in nutrition and applied physiology. Courtney is an experienced nutritional and health consultant in the New York metro area and beyond into the universe, and will help guide you on a path to wellness and health. So on the topic this week, people often think that if you have a problem with your liver, that it is directly attributed to drinking too much alcohol. But that is not necessarily the case. Even if you don't drink, you can have liver disease and you won't even realize it most of the time. According to the Mayo Clinic, non-alcoholic fatty liver disease is an umbrella term for a range of liver conditions affecting people who drink little to no alcohol. The main characteristic of this is too much fat stored in liver cells. The cause of non-alcoholic fatty liver disease is hard to really diagnose, as there are few symptoms, and therefore it's hard to discern if you have an issue. There are certain risk factors which include obesity, gastric bypass surgery, high cholesterol, and type 2 diabetes, which can affect the liver. It is increasingly common around the world, especially in Western nations. In the US, it is most common form of chronic liver disease, affecting about 1/4 of the population, which, Courtney, you'll have to, give us some info. That's a lot of people.
It sure is, yeah.
So over time, inflammation and scarring of the liver, which is cirrhosis, can occur, and doctors will treat the underlying condition and continue to follow any additional signs that you are having problems with your liver. So Courtney, please give us some info on this important topic, because it's something that's kind of under the radar. So
Sure,
can you
sure. No,
start?
happy to, and good to see you both. So yeah, I feel like so many individuals have not heard about it, so it is important. There aren't many symptoms like you mentioned, Maxine. So I thought I would first start, since we're talking about the liver, to give a little sort of liver 101, sort of anatomy and physiology. We all know we have a liver. Some of us might not know the important functions that the liver does, and there are hundreds of them. Do not worry, I'm not going through all hundreds of them. We're just going to go through a few. So it is the worker bee of the digestive system. So if you think about where it is in your body, think upper right quadrant. It's about, the size of a football. It's about 3 pounds. It is the second largest organ after our skin. And it sits basically under the ribs and below the diaphragm. So that's where it's positioned. It's very close to, as you can imagine, the rest of the organs of the digestive system. So one of those hundreds of functions that it has is its ultimate role in being the body's filter. So everything you eat, everything you drink, every medicine you take, whether it be over-the-counter, prescription, or otherwise, every alcoholic drink that you drink, even any herbal therapies that you take in, are going to have to get filtered through your liver. So very key, very important job. It helps keep sugar in control. If you guys remember back to some of our previous episodes when we spoke about how the body utilizes sugars, glucose, anything that is left over, unused by the cells, it is stored in the liver as glycogen. So liver gets a message, we need more glucose to use for working cells, moves it out, comes back in when it's not needed. So it really has a very significant regulatory role in keeping blood sugars where they should be. It produces bile, which, if you think of bile as so it produces, and it's actually, is going to secrete bile as well. Consider it sort of this aqueous solution that contains proteins to it. So it helps break down and absorb fats in the body. So if you think about its role in that capacity, it might make a little bit more sense how this non-alcoholic fatty liver disease has something to do with excess fat getting stored in the liver. So there should be some, there just shouldn't be the excess that we're seeing.
Courtney, are there any, I mean, how would you even try to check for it? I mean, if you go to the doctor, and shouldn't it not kind of be routine to maybe check such an important organ in your body? One would think, yet I never really,
Yeah,
I know there's
so
tests, but I don't know what they do.
right. So the first step, of course, so if you're not familiar with this, so, hopefully everybody's getting a physical, and that would be the first and foremost thing. We talk about this a lot, just the type of care that you should be getting. And at that physical, some of you might have, seen or experienced where your doctor actually feels for, around your abdominal area. And one of the things he or she may be feeling for is an enlarged liver. So that's one thing, one way that it may get picked up. But the reality is it's not going the early stages, and the early stages really are considered this non-alcoholic early stage, sort of non-alcoholic fatty liver disease, as opposed to the advanced stages of it, which is called, the abbreviation is called NASH. So that is steatohepatitis. That's different. That has more complications associated with it. So earlier stages, you can live with it. It's not ideal, but it's not necessarily going to be problematic. The problem arises when there's an increase in inflammation, increase in cell damage. You mentioned earlier in your intro, Maxine, about there can be cirrhosis. Once you get to that point, which hopefully you can prevent, this is where you get obviously more flags. You might become symptomatic, meaning that you might feel uncomfortable, you might feel some pressure, but typically it would be part of a physical, blood work that's typically done. There are things called liver enzymes that are done. So again, it's a little tricky. So I think if there were a way to figure out how to pick this up earlier, it would be wonderful, but we're just not quite there yet. So
Yeah, but the liver seems to be the gatekeeper for a lot of these enzymes that you have in your body. Couldn't they do a blood test to see whether there's an overproduction of
you do. That is
whatever
what they do.
enzymes?
But it doesn't always, your liver enzymes can be up, could be high, could be low for a variety of things. If you went to a wedding this weekend, or you had a real bender of a vacation and had your liver enzymes drawn, they'd be probably elevated too. So it is not the gold standard. So the reason why I bring this up is that, first of all, it is hard to sort of pick up on the earlier side, and we really don't know at this point the absolute factors that are contributing to it. Some of the factors that are believed are increasing rates of obesity, not just in the United States, but we're starting to see it worldwide, but not to the extent as we see in the United States. Uncontrolled blood pressure, uncontrolled diabetes, so that constant levels of elevated blood sugar. So some of these could absolutely be contributing to the rising rates of fatty liver. So the best message that I would like to talk about today is all of those things that you can do to reduce your risk of getting there in the first place. So again, to firstly avoid, initially non-alcoholic fatty liver disease, and hopefully prevent it from getting to the more advanced stage of NASH, and then advanced stage after that of cirrhosis. So did you guys have any questions? I'm going to go right into
I think, yeah, I mean, my question wasn't, you just brought it up, is how do you reduce your risk? I was asking about tests, but so now what can you do to reduce risk or prevent? What say you, Courtney?
What say me? Well, what say me through the lens of what we know, so far, right? So it's important to realize that up to 90% of the cases of non-alcoholic fatty liver disease are seen in individuals who have obesity or overweight. That's significant. And I know that we're trying to change the narrative of, you can be healthy and be overweight, and that is absolutely the truth. But the factor of the matter is, we do see increased risks of a variety of different diseases with individuals who are carrying too much weight. So this is not a message of saying you got to be skinny mini. This is a message of you can absolutely reduce your risk by losing 5 to 10% of your body weight if indeed you are overweight or are carrying, you're obese. So go ahead.
Excuse me, just your body weight or your body fat?
Right now it's body weight. Now we do know that body fat has a role in this as well, which is why when we're talking about weight loss, if there's a way to get people to lose just body fat and leave muscle alone, we'd be rich. But there's no absolute way to do that aside from, and I'm not suggesting this, liposuction where you're just removed. That's not the plan. So with weight loss, you are always going to have some fat loss, and you're also going to have, unfortunately, some muscle loss as well. So when we talk about weight loss, we're just talking about, 5 to 10%. Obviously, you're going to try and do a little bit of activity. You're going to try and do some resistance training in order to preserve that muscle mass, so that you hopefully lose less muscle over fat. But the message would be to definitely try and achieve some kind of weight reduction to reduce your risk.
Okay.
So one of those ways, of course, is activity level. We talk about this a lot on the show, and activity doesn't have to be a CrossFit class or, doing an ultra marathon. It really can be whatever works for you that meets you where you are right now. So whether you are super active or whether you are sedentary and trying to make more of an effort to be more active, there's a way in both of those scenarios to try and get your activity level up. Why? Because we know it helps with weight maintenance, certainly. We know it helps with regulating blood sugar, and we know it helps reduce blood pressure levels. So all of these things, which may be factors contributing to that non-alcoholic fatty liver disease, can be helped with some weight reduction, could help, if you're including some kind of regular exercise routine.
Yeah, it's important to exercise. And so right after this, I'm going to walk my dog.
Yes, you should. I do want to talk a little bit about, because one of the, again, we don't really know exactly what the reason is. Part of the American diet, unfortunately, is not where it needs to be. And we're not looking for perfection, but we're looking to move the needle, hopefully a little bit in a lot of folks, to get them to eat less processed foods, to reduce the amount of, I call them the crappy carbs in the diet, right? Which contains something called fructose. And what we know about fructose, right, is that it's metabolized a little bit different than glucose is. And unfortunately, that difference in metabolism is putting stress on the liver. And that may be one of the reasons why we're seeing an uptick in this non-alcoholic fatty liver disease. The way it's metabolized by the liver, it promotes something called lipogenesis, which will, if you think Genesis, creation, lipo, it creates an environment where your liver is creating more fat. So it could be one of the reasons why.
What are some of the crappy carbs? Just to point a couple.
Yeah, sure. Think about, pastry sweets, your typical line of dessert type items, that whole category, whatever it is. Crappy carbs can be like, super ultra refined crackers, or super refined flour, or, breads. It could be, excess sweetened beverages, so anything, and that's just a few of them, that highly processed foods that have these refined flour products in it and very little nutrition along with it.
How about hamburgers with extra cheese on it and French fried potatoes and a Coke?
Well, there's the Coke, and then certainly saturated fats are not going to help. So you brought it up, Malcolm. Anything that is going to affect overall inflammation in the body could be a contributing factor as well. So we know that saturated fats, not all of them, are going to adversely affect your blood lipid levels. So you want to tap down those, certainly tap down the trans fats in the diet. But the reason why I particularly brought up the fructose is that it is being studied and continues to be studied. We do have some data to suggest that maybe because we eat such a diet high in sugars, that this may be part of it, particularly as it relates to that fructose.
Yeah,
Wow.
I think you had mentioned that This fatty liver is becoming worldwide. It's not. It's increasing around the world. And I remember they were doing studies how the American diet, the McDonald's, the Burger Kings are now worldwide. They're around the world and becoming very popular. And all
Yeah.
these countries that used to have the fairly healthy diet have switched.
Right. So it adopts a more Western way of eating, which
Right.
unfortunately is not necessarily the greatest way to eat. So so that could be one of the reasons why we're seeing increased rates, worldwide as well. But the good news is, so reducing those foods that we just spoke about, talked about moving a little bit more, if appropriate, drop a little bit of weight. But there are many foods, and we've spoken about them before on a variety of our segments, that you can include that may be helpful, in particular to help with non-alcoholic fatty liver disease, to hold it where it is and keep it from progressing, which is a good thing. And in some studies, they're actually suggesting that it can actually reverse some of the damage.
What foods? What are you talking about? Which foods?
Yeah. So obviously, no surprise here, vegetables and fruits, particularly vegetables and particularly green leafy vegetables. And they believe that it's because of the very high polyphenol content inside these green leafy vegetables. So think about kale, spinach, think about collard greens, think about that whole category. Now, obviously all veg are going to be helpful and bring different things, but as it relates specifically to what we're talking about today, the studies seem to be very promising with regards to the polyphenol content and in green leafy vegetables. Beans and
green
legumes.
tea? Green tea? No.
Well, I'm sure there's a polyphenol content to green tea, so not necessarily a bad thing. I don't know of any studies specifically that speak to green tea being helpful for reducing some of the abnormal liver enzymes, but we know that there are other promising helpful benefits of green tea, so certainly no downside to it. Now do keep in mind a lot of these teas, and thank you for bringing that up, so herbal therapies, and then I'll get back to things you should be including. Just because an herbal therapy is available to you over the counter does not necessarily mean it can't cause harm. So I do want you to be very aware of different compounds you might be taking. If somebody's listening and you're taking an herbal treatment, read it. Hopefully it's a reputable company. If it's a supplement, look at the supplement fact and see if it has third-party testing to ensure some of the purity in it, because just like we said at the top of our time together, your liver's getting first crack at everything. And if there's no control over what is in these herbal therapies, then there's a chance that it may be doing a little bit of harm, not necessarily good. Right. So I digressed there, but it was important because we do see some hepatotoxicity in using some herbal treatments, herbal therapies.
Wow. Okay.
So
what other foods? What other things?
Yeah. So beans and legumes, we love those. Why? Because the resistant starch that's in there. So think of it as opposed to crappy carbs, these contain the good carbs that are they take just a longer time to break down. Why is that helpful? May help regulate blood sugar. If blood sugar is in control, probably less inflammation in the body, less demand on your liver. So there is one of the reasons why the beans and legumes may be beneficial when it comes to non-alcoholic fatty liver disease.
Can individuals be proposed for these diseases? I mean, it's because you always hear something like diabetes. It's sort of like almost inherited.
There is although I don't know what percentage, but there is a small genetic component to non-alcoholic fatty liver disease. I don't want to misquote. So we're saying that a lot of, what we're seeing is a lot of lifestyle factors that may be contributing to these rates, but to be fair, there's a small percentage that could be just genetically loaded. So
yeah, because they say the same thing with alcoholism, that if like your parents were alcoholics, there's a good possibility that you will, or that it runs in the family.
Right. It may pick up as alcoholism, or it may pick up as some other disorder. So yeah, so there's the whole, decades worth of studies as it relates to, alcohol intake. Omega-3 fatty acids. I just want to get back to the foods while we still have some time. So it appears that, and we've spoken about omega-3 fatty acids before. So whether you're doing this through foods, or supplements, or some combination of those two, it appears that not only will omega-3 reduce or may help reduce triglyceride levels, but the reduction in inflammation that omega-3 fatty acids may yield may actually help reduce the amount of fat in the liver. So again, try to do it with your foods first. We always talk about that. If you just can't do it, then absolutely find a good omega-3 supplement and try to increase it that way.
Yeah, I'm doing that. I take the krill oil, the
Sure,
superior triple, look, the higher end one that I can find. And yeah, it's very something that I take daily, but I think you're right. It's very important. I didn't realize how much until my doctor started screaming at me. So
hopefully not too loudly.
No. You know me.
You're a doctor, and Courtney.
No, I would never yell at Max. No way.
Courtney does not yell at me. I don't think. What?
I do have good news about coffee. So again, this is all, preliminary, but
good. I'm just
there it is. So apparently 1 cup of coffee, so think roughly 8 ounces, may decrease the number of abnormal liver enzymes.
Is that black coffee? I mean, or do you
black coffee, just standard.
What if you put a little tap of milk in? What happens?
Nothing. It's not the addition of the milk. It's the activity. I think remember, coffee, just like teas, have a certain amount of these plant chemicals in there that may be beneficial. I'm not suggesting if your healthcare provider has told you to not drink coffee, you certainly don't add it on your own. But if you happen to be somebody who drinks a cup of coffee a day and you have found out that you have alcoholic fatty liver disease, there may be a benefit in continuing to do so.
Anyway, on this happy note, I think we have to end our show.
Well, at least it has to do with coffee, and you can have your cup.
Right.
A cup is a good thing.
Yes.
But I kind of vary between coffee and tea. I love tea. I'm a teetotaler.
So, and then the last 2 I'll mention, because these are important. I want you to watch the news and the data, is vitamin E. So we want foods first. At this point, the data is just way too preliminary, but foods high in vitamin E, seeds and nuts. Very particular. Do not supplement E on your own. It's way too early, but it's certainly promising. But you certainly can get a goodly amount in the foods that you eat. Like I said, lots of different seeds and nuts that you can include, and turmeric. And you can cook with that. That appears to decrease the markers of liver, indication of liver damage. So see your healthcare provider, please. He or she can help you get your blood work. You're going to want to see a liver specialist if you believe you are at risk, or you've been told by your primary care physician. And that would they are typically gastroenterologists. They are gastroenterologists, so it might be under that division if you go to a group. But see a liver specialist for sure.
Okay, thank you very much, Courtney. And
great
Max,
tips,
take
Courtney.
us out.
Thank you. Great. Thanks, Courtney. That's good information. So thanks for joining us for Courtney on Health. To get more info, follow Courtney on her Facebook page, which is Courtney on Health, on Instagram and TikTok. You're a TikToker at CLG Wellness. Visit her website, CourtneyGravenese.com. For past shows, go to MalcolmPresents.com and theManyShadesOfGreen.com. And here we are, Courtney on Health, smart, sound nutrition, strong, safe fitness. And we will catch you again next time.
Catch you next time. See you guys. Thanks.
See you guys. Bye. Thanks a lot, Courtney. Max.
Bye, guys.